Patients are not always going to remember names. They're in a vulnerable situation. They're very focused on their illness and getting better, and there are so many people that they come across that it's unreasonable to expect them to remember everyone, and that visual aid is really important.
I know as a patient myself as well how that when I have been a patient, how those simple things make such a difference. And you can get the best care in the world. If you don't have those simple things, then the patient experience is not great.
I think it'll benefit all areas of the organisation. It's such a simple idea. It's just so easy to forget to say your name. We have a lot of doctors that rotate through and they don't know anyone here, or they don't know the nurses, and just to have that culture of saying who you are and why you're there, I think is really, really important. When patients come in, they're often anxious and nervous and they don't know, but just seeing a friendly face and someone telling them who they are seems so simple, but it just is so vital to putting everyone at their ease. So that's...
They know who's looking after them, they know who to ask for, they know who to refer back to, and that gives them a lot of, gives them some power in a situation where they're very powerless, I think.
Everyone understands that in emergency, that doctors, everyone's busy, they're flat out, there's a person in the waiting room sitting there for 4 hours, not happy, just for someone to say, oh hi, my name is, they feel like they're important, that their time's, you know, precious as well, that they're important to the doctor. So I think it's going to be a really positive outcome.
If everything around you is falling to pieces, those little things make the world of difference.
Communication is always one of the biggest issues surrounding patient feedback where they don't feel that they've had a good experience.
In order to provide good healthcare, it's really important to have a kind of a working relationship with your patients, and I think you best achieve that if there is some sort of personal relationship as well.
I think people will just feel more comfortable and feel at ease to come here, because hopefully that extra touch of caring and compassion will be there and will show. The community will know who they're actually dealing with and what people's roles are, that we all have different roles in the organisation and in caring for people. But I think at the end of the day, because of that, to be less adverse events and less complaints, because people feel that they're receiving the care they've come for and are expecting from us.